Ask the Doctor with Michael Lang begins in 30 seconds.
When it comes to your health, are you seeing the check engine light come on more than normal? It's time to get under the hood. It's time for Ask the Doctor with Dr. Michael Lang. Sponsored by Lang Eye Institute and Fortify Vitamins. Dr. Lang is a board-certified optometric physician and certified nutrition specialist, helping people see and feel better through proper nutrition for 25 years. The doctor is in. Call now with your questions at 877-969-8600. That's 877-969-8600. Here's your host, Dr. Michael Lang.
Good morning and welcome to Ask the Doctor. I'm your host as usual, Dr. Michael P. Lang, P for Paul. And I'm here in the Salem Media Studios broadcasting live. This is sometime in August 2023. If you got a question, remember this is a live call-in show, so don't hesitate picking up the phones and giving us a call. We're coast to coast, and we're live video streaming all over the world. So it could be good morning, good afternoon, or good evening, depending on where you're picking us up. Give us a call at 1-877-969-8600. That's 1-877-969-8600. I've been hosting Ask the Doctor since April of 1993. Folks, that's over 30 years. Time flies when you're having fun. And I want to mention that we've got a big gig out at the Tampa Bay Fairgrounds today. We're inviting everybody to come out to the Fit Fest. Fortify Vitamins is there. We got a big booth set up. We got Arlene, we got Tammy, we got Mackenzie, we got Kane, we got me. We got a whole crew over there. Doc Hall is not going to be there today. For those of you that are expecting to see Doc Hall, he is not making it to the show today. But we have Dr. John Poser, a pretty famous plastic surgeon, in the studios with us. We got Dr. Susan Somerton, and we also have the infamous Roger P. Showman here in the studios with us as well. All of you in the Tampa Bay know Roger. He's been a radio guru, for a newscaster for, I don't know, about 118 years now. So anyway, once again, phone lines are open, 1-877-969-8600. Come on out to the Fit Fest. It's at the Florida State Fairgrounds. We're at booth 1001. 1001. We're going to be going 25% off all Fortify items. We're going to run the BOGO there. Buy one, get one free on our Super Omega and our Fortify Macula Defense. Also, remember that BOGO is still running until we run out of that lot number, probably for another week, and it's going to all be gone. So remember, Fortify Super Omega, a lot of you guys and gals are taking it. It's buy one, get one free on the internet at fortify.com, Fortifeye, fortify.com. And we're doing that BOGO because they expire on November 1st. They don't really expire. Folks, they're good for another few years after the expiration date. They don't just blow up on that date. So it's an amazing deal. Buy one, get one free on the Fortify Super Omega. Come to the Lang Eye Institute Fortify Nutrition Center or the Lang Nutrition Center in Ocala. Remember, Fortify Nutrition Center in Clearwater is closed today because Arlene and Kane and the gang is at the Fit Fest in the Tampa Fairgrounds, and it opened at 8 o'clock this morning. We're there today and tomorrow. All right. Susan, are you there? Good morning, Dr. Susan Somerton.
Good morning. I am. Hello to all the listeners out there.
Excellent. So Dr. Somerton is an asset at the Lang Eye Institute. She's a board-certified optometric physician. She's also fellowship trained, and she's got a lot of credentials next to her name in nutrition, more than anybody in the state of Florida. And also, my very welcome guest and good friend is Dr. John Poser. Poser Plastics from Gainesville and Ocala, does surgery here in the Bay Area as well. And he's sitting in the studios with me. Good morning, John.
Hey, Dr. Mike. Good to see you. And thanks for the invitation to come on your show.
Oh, we've been wanting to have you for many moons now. Dr. Poser and I have worked together for many years. He was upstairs in the Lang Eye Institute for many years back in the day, and he does a lot of not only cosmetic facial procedures, but plastic procedures, a lot of our lids, blepharoplasty, and brow lifts, and ptosis repairs, and entropions and ectropions. And we're going to talk more about that in a few minutes. But let's talk. You opened a new office in Ocala, right on 3101 Southwest College Road in Ocala. That's my old Lang Eye Care building. And in that building, we have Reboot, that anti-aging wellness center, the Lang Nutrition Center. You also have the neuropsychologist, Dr. Patrick Watson, and you have your suite up there for plastic surgery, right?
Yeah, I started the office about 2 months ago. It's a great office with all the other doctors with me, including now a new acupuncturist, I guess. It's all filled up on the top floor, and anybody wants any information about nutrition or plastic surgery of the eye or other medical advice, please come to that floor in the Lang Eye Care building on Highway 200.
Right.
Was it 3101?
Yeah, 3101 State Road 200 or Southwest College Road. It's got two names for the same road. Could be confusing. And some of those procedures you can actually do right in your office. You've got, the equipment and technology to do right in that suite, don't you?
Well, after many years of experience, I can do a lot of things under local anesthesia that maybe other doctors won't do, but a lot of things on the eye can be done under local anesthesia, including upper lower blepharoplasties, cheek lifts, brow lifts, and sometimes even forehead lifts. So I say about 80% of my patients are okay with it. The other 20%, please give me a Valium or a rubber hammer to the head or something to help me out.
That's a famous laugh. You hear Roger P. Showman. Good morning, Roger. How are you?
Good morning, doctors. My goodness, I'm surrounded by all of this academic and medical knowledge today.
Well, you're going to chime in a little bit. We're going to find out how you're doing. You've been working out a lot in the gym. You're my workout partner, and you're going to get some shoulder rehabilitation. We're going to expand on that in a few minutes. But Dr. Somerton is on hold, and since we're talking a little bit about plastic surgery of the eyes today and a lot of other things, nutrition and anti-aging and wellness, Dr. Somerton, we have something that is non-surgical for people that have baggy eyelids, ptosises, and they're contemplating having eyelid surgery, but we have something at the Lang Eye Institute we can do, don't we?
We do. There are those patients that would have that, what we call acquired ptosis. That's those low-lying lids, and maybe they're not quite ready for that surgical intervention. They've got other things going on, and it's actually something just as simple as a prescription eye drop once daily, and they simply put it in their eyes. One drop in the morning is preservative free. It doesn't hurt. And that will give most people just that little lift of their lids. Not for everybody, but we do provide samples in our office. I tell people, put a drop in. Well, first take a picture of your eyes, put a drop in, wait about 30 minutes, take another picture to see if you can tell the difference. Because if those lids are coming over the pupil, it's affecting their vision. That'll affect their driving, their reading, their computer use. So we want to make sure they can see the best and not have any trouble getting that light in their eyes.
Absolutely. We've literally probably got thousands of patients on it right now. It's probably putting a little bit of dent in Dr. Poser's procedures. But if that doesn't work, then we'll send them to Dr. John Poser for an eye lift.
Yeah, one thing I have to say that most people have senile ptosis, which means their muscles are wearing out and they have too much skin waiting on their eyelid. It actually goes all the way to the eyelashes. And that weight causes fatigue on the eye muscle itself, especially a Mueller muscle, which is a sympathetic or autonomic muscle that keeps the eyelid up. So the medicine probably makes that muscle a little stronger and raises it up. But over time, the weight of the extra skin or even a senile detachment of the Mueller muscle from its ligament can cause the eyelid to drop down over the pupil, and therefore you get blocked vision. So you can use the medicine. It probably helps for a while, but if it doesn't help after 6 months, you probably do need some kind of plastic surgery.
Yep. All right. We're getting ready to go to the phones in 1 second. Bob, stay tuned. Don't, we're going to go get you in just a second here. I know you've been on hold for a while. I want everybody to know you can follow on Instagram. Remember, there's a lot of fake Instagram accounts out there. If you put Dr. Michael Lang under Instagram, 200 fake accounts come up. The only legitimate one has a blue check next to it. That's mine. It's verified. We got about 80,000 followers right now. So you can be a follower on Instagram. It's Dr. Michael Lang _. Dr. Michael Lang _. It has a blue check. You know, if somebody chimes in and tries to talk to you and they have an Instagram account, it has my pictures and my name, and they got, 25 followers, no blue check, it ain't me. So if you've been talking, you think you've been talking to Dr. Lang, you haven't been. All right. I'm a busy man. Also, go to our YouTube channel. You can pick up any of these videos. These are live videos. If you go to Dr. Michael Lang Ocular Health Channel, Dr. Michael Lang Ocular Health Channel, and you can see videos from 20 years ago. I mean, we didn't have a video camera hardly back then. So go to Ocular, and you can see Dr. Actually, I was going to call you Doctor. Roger P. Showman. Dr. Roger P. Showman is in some of those videos back in the day when we were hosting it right before the big show. Remember?
Oh, right at the old penthouse. Yeah, that was a good time.
It was good times. Yeah. All right, let's go to the phones. Bob's been waiting patiently for 35 minutes. Bob, good morning. Welcome to the program.
Good morning, doctors. Pleasure to talk to all of you this morning. I have a question. My wife, most of you know that my wife has MS, and the go-to drug that seems to work for her is one called prednisone, and its side effect leads one down the path to diabetes. And I'm curious, to my own knowledge, it won't have any effect on my wife one way or the other. What does that drug do to cause the body to turn to diabetes?
All right, that's a great question, and we're going to expand on that, both me and Dr. Poser. But first, let me just address what it can do to the eye. Prednisone is a corticosteroid, and sometimes it can be life-saving. I mean, people, in order to breathe, in order to move, collagen vascular disease, autoimmune diseases. So this can be a valuable asset as prescribed by a doctor like your rheumatologist or whoever's treating her. But the steroids can also cause complications, obviously, and the higher the dosage, the more potential complications. So a posterior subcapsular cataract is one type of complication in the eye. It's a special type of cataract related to steroids. Elevated intraocular pressure, that means it can potentially cause steroid-induced glaucoma as well. Now, systemically, Cushing's syndrome, high blood pressure, elevated blood sugar, okay, aka diabetes. So certainly, as long as it's taken per the prescription, more is not better, and you're monitored by your physician, it can be a valuable asset to help her. Dr. Poser, I'll let you chime in about steroids a little bit more.
I'm not an expert at this type of thing as far as diabetes, but I do know that the greater the stress level in the body, the more you develop diabetes, and it's a stress hormone like cortisol is. So most likely it takes away the insulin power, makes it weaker, and blood sugars go up. I might add that if you add vitamin A to your supplements, it may counteract some of the effects of the steroid. And the third most important thing is you might want to investigate stem cells, because they are doing it now. It's not totally FDA approved, but I've been at seminars now where 2 stem cell injections almost turned around people's lives with the disease your wife, multiple sclerosis, the disease your wife has. Yeah.
Wow. Stem cells are coming a long way. Stem cells for the eye as well. So maybe actually look into the stem cells, a little bit more too, Bob.
Doctors, I appreciate that. I will do that. Do that very well. Thank you. Lord willing, we'll talk to you next week. Have a good week.
Take care, Bob.
Bye-bye.
All right. Once again, you're listening to Ask the Doctors. I'm Dr. Michael Lang, host of Ask the Doctor for over 30 years. Dr. John Poser of Poser Plastics, a plastic surgeon in the Gainesville, Ocala Villages, Tampa area, who now is on State Road 200 and the 2-story building right where the Lang Nutrition Center is. So you can come visit him there. Or certainly you can come to the Lang Eye Institute and see Dr. Susan Somerton or myself or Dr. Lori Caputi for an eye exam, and we can determine if you are indeed a candidate. So I want to mention something about patients that everybody listening right now has. Everybody listening has sandy, gritty, burny, teary, itchy eyes. These are symptoms of dry eye. And, we've created some supplements. We've got the Fortify Advanced Dry Eye Kit. We talk about omega-3, black currant seed oil, Fortify Focus, all these things for dry eye. We put it all together in the Fortify Advanced Dry Eye Kit. It has all 3 of those bottles in one box. Folks, it's a nutritional support to help the dry eye symptomology, subjective and objective symptoms. And we've seen thousands of patients benefit from this. Remember, God made a pretty good body as long as we give it the right fuel, So there's a lot of products out there. Check out Fortify Advanced Dry Eye Therapy. But a lot of you are doing everything that we talk about. A lot of you are drinking water, eating a banana, having a handful of C's to get the magnesium and the potassium, and you still have some dry eye symptomology. Well, we've talked a lot about, and we've done thousands of punctal implants or punctal plugs. The problem with punctal plugs and punctal implants, you got to stock like 15, 16 different sizes. And so a lot of doctors don't want to do that because it gets very expensive. Now, we do stock all the different sizes and the different brands, but now it's becoming a little more simpler these days, isn't it, Dr. Somerton?
It is. When we were at our last eye doctor convention and they have all the exhibit booths, we're also wandering around learning about new products and what's out there to get the latest and greatest. And there's a new one that is fast becoming our favorite. It's a tapered plug. And people have had plugs before. Not only is the problem with the size, it's also making sure the patient gets the exact size, because we've had patients that have the older style that they pop out. They don't stay in. So we're shifting towards these new plugs that go down deeper, and a tapered one is the latest and greatest, where it starts off small, so it slides in there, and it gets wider, so it stays in there and does its job for a full 6 months, and then they dissolve. But we're just getting much better results. They're more comfortable. Patients don't feel them, and they're working to relieve that dry eye.
And it's just a topical anesthetic, right? It's a painless procedure, and it takes about a minute, doesn't it?
It does. And we can technically do it without the anesthetic, but we do use it. We want to make our patients less sensitive to the light and have them just look away. And all they feel is just a little tiny press of our finger on the eyelid. It goes in the eyelid, not the actual eye. Some patients are a little afraid because we're touching the eye, but it's actually the eyelid.
Right. So that's called punctal occlusion, punctal plugs, or punctal implants. We do it at the Lang Eye Institute. Dr. Susan Somerton's an expert in doing it. I refer most of my patients for her to do it because she does so many of them, and she's just like an artist when it comes to this. So if you want to have those punctal implants done or see if you're a candidate for it, remember, it's a painless procedure covered by Medicare, covered by most insurances. Set up an appointment to see Dr. Susan Somerton at the Lang Eye Institute. All right, phone lines are open. 1-877-969-8600. That's 1-877-969-8600. We talk a lot about omega-3, and we're running that BOGO once again. Buy one, get one free on Fortify Super Omega. I got to tell you, when I met Roger P. Shulman, years and years ago, he was having a lot of problems with his shoulders.
Yes.
Yep. And I think we started you on the omega-3, and what happened?
Well, I thought I was going to have surgery, and I was getting steroid injections every 6 months or so. That all went away. Basically, it cured it and kept it away for quite some time. I had a little flare up, but went to the doctor, and he's pretty pleased with the results of the omega and the curcumin now, which I added to that, and it seems to be back to where it's supposed to be. So I'm very, very happy with that.
Right. That's the next gen curcumin we developed last year. It's a curcumin called curcugen, and curcugen is the only oleoresin food grade curcumin on the market currently. So we decided to use that, and it's 57 times more bioavailable than the next best thing on the planet. And it is very effective at helping to reduce pain and inflammation naturally. And when you combine it with our omega-3, we call that Omega Relief. And on the website at fortify.com, it's discounted because it comes with a bottle of the Super Omega and a bottle of the next gen curcumin. And we call that Omega Relief. And if you want to go to the next level, you go to Omega Relief Extreme, where we add the black currant seed oil, GLA. That's also been shown to help with inflammation and pain. So remember, these are not treatments. This is nutritional support for your body. like I always say, God made a pretty good body. We just got to give it the right fuel. That combined with exercise and weight management, positive mindset, the right amount of sleep and hydration, it's a win-win. You can live forever. I mean, Roger, you're doing pretty good. I mean, you're my workout partner, and we
Yeah.
work out a lot, and you're a few years older than me, but man, you press a lot of weight.
Well, I'm doing pretty well, and I do credit those supplements with helping quite a bit because I was in pretty bad shape before that, and it was 2008 that I started getting on that. I was on some other stuff, but it has improved immensely. The quality of the fish oil is much better than your competitors, I've found.
Well, it is. You know, years and years ago, I went to Norway and did some research, and I wanted to make. I looked at all the competitors that were made in Norway. I'm not going to mention their names for legal ramifications, but what I did, I decided to make something more potent from the same factory for a cheaper price, and it's worked. I mean, we do sell a lot of this Fortify Super Omega and Super Omega Max globally, and on Amazon. So you can get it on Amazon, folks. All the Fortify products are on Amazon, or you go directly to fortify.com. It goes out the same day. Talking about working out a little bit, Susan's on the phone now, and you know, you're my workout partner on Thursday, Friday, Saturday,
Right.
and Sunday. No, Friday, Saturday, Sunday, Monday. And Susan's my workout partner in the Villages on Tuesday, Wednesday, and Thursday. And Susan and I have been trying a new form of Fortify Fit called Fit Pro. It's not available yet. But Susan, we've had some extra energy. I know I've had some pretty good strength on this new Fortify Fit Pro. What about you?
We have. We've noticed going to the gym, you can add on a little bit more weight and go for a little bit longer. It just gives you that extra energy. And we do it after work. So that's when we are more tired. So that's when we have time to go. And it does make a difference. After you've worked all day, you need a little extra energy to get to the gym and motivate you to do what you need to do. And it makes a difference. We've had a fun time trying the different flavors too and seeing which one we like better. We're going to have numerous ones coming out, right?
Right. We have 5 flavors, and we did some taste tests the other day over at the Fortified Nutrition Center. Roger P. Shulman was there to taste it as well. And we've got fruit punch, strawberry, watermelon, salted caramel, pina colada, and blueberry lemonade. And all the flavors were delicious, weren't they, Roger?
Yeah, I like that chocolate especially. That's delicious.
Yep. And he's talking about the chocolate super protein. It is. That's our whey protein.
I'd like to add one thing. Mike mentioned exercise. Well, that's one of the greatest anti-inflammatory things you can do because you get you release endorphins, which is very strong anti-inflammatory hormone. Plus, you release growth hormone, and growth hormone actually helps heal your body and put protein back in the muscle. So, when you work out, lift weights, and take Mike's protein, growth hormone kicks in and puts that protein right back where it should be. So remember, exercise should always be part of your anti-inflammatory recovery.
And really at any age, right? I mean,
Any age.
you know, some people turn 70 and say they can't exercise. 80, they can't exercise. My mom's 96 and she still exercises.
Oh yeah, and she's still producing growth hormone.
Yep.
And I'm 77, and I feel better than I have in years when I do exercise. You're absolutely right, doctor, about that.
Yeah.
All right, we're getting loaded up on some phone calls, so we're going to take some calls here. Let's see. The first caller, I think, is Chris in Florida someplace. Chris, thanks for holding. Good morning.
Good morning.
Good morning. What can I do for you?
Hey, I probably spoke to you about a year ago. I have Sjogren's disease, severe dry eye disease, and they've been treating me progressively for about 3 years. And I'm to the point now, I take Restasis, eye drops. I take a vitamin called Hydro Eye. I'm not on any of your regimen. And even the serum tears. And I would get filaments in my eyes 3 times a week. And fortunately, I had an eye doctor. I could just walk in and they'd take them out. And now, even with the serum tears, maybe about once every 1.5 to 2 weeks, I have to go get filaments taken out of my eyes. And I'm just wondering if there's anywhere I can go from here.
Absolutely. Number one, not to knock the competition, I would highly recommend considering the new Fortify Advanced Dry Eye Therapy Kit. It's called Fortify Advanced Dry Eye Therapy. It's really, I don't want to brag, but it's light years ahead of anything on the market right now to help nutritionally support dry eye. Then I would recommend using one of 2 lubricants due to the hyaluronic acid, either Oasis Tears Plus or Optase. Oasis Tears Plus or Optase. And then I would highly recommend considering, if you haven't already, having those plugs put in that we were talking about with Dr. Summerton. The punctal plugs
I've
will
had
help.
those.
You've had those? Okay.
Yeah, I've had them, and one of them fell out, and they never put it back in. But they didn't seem to, solve anything.
Right. And then the final phase that I like for Shogun's the best is a drop called Regenerize. All right. So I know you've tried the anomalous serum tears. Regenerize is a new generation amniotic fluid. So it has human stem cells in it. Regenerize, you can only get through your doctor's offices. We do have them available at the Lang Eye Institute. You can get them through our Fortified Nutrition Center, and you would use it 2 to 4 times a day, depending on how dry your eye is. That's something to consider. I've seen some amazing changes on the Regenerize. And next time you see your optometrist or ophthalmologist, tell them to give you a prescription for Sequa instead of Restasis, okay? Because Sequa is the new generation of Restasis. Remember, Restasis, the patent's off of it, so it's generic now. So it's made all overseas. And I'm seeing some people getting some interesting results, some really red, irritated eyes with the generic version of Restasis. So Sequa is the new generation of Restasis. Ask your doctor to write a script for that. Consider the Regenerize and consider going to Optase or Oasis Tears Plus and the advanced dry eye therapy. And if you try all that, I think you'll get results. And if you still don't, there's other things that can be done now. You can go to an amniotic membrane that we're going to talk about in a minute, which is a stem cell enhanced amniotic membrane. And there's a variety of sizes that are actually available today. As a matter of fact, Dr. Summerton, we have a new size that we're doing for people with Shogun's, don't we?
Yes, just like the others, we're constantly on the lookout on how to improve and treat each patient individually. And we found that customizing the size as well as the thickness, whether a single layer or double layer, depending on each patient's condition, we're able to get that cornea, that front surface of the eye, healed quicker and more effectively. And it is about finding which one is right for each person. The new one that we're working with is smaller. You don't feel it as much, and it soaks into those cornea, those stem cells, and it works quite effectively.
Right.
I did want to mention, he brought up filaments, I believe, and Sjogren's, which filaments is another thing that can affect with the dry eye. And there is some research you can look at for those acetylcysteine drops, specifically.
I've got some of that coming.
Good.
I have some of that coming.
Good.
That one has been
So that's
studied
good, right?
for the filament. Yeah, that's good for the filament.
So Chris, give all this a try. And if you can't remember everything, just go to the YouTube channel and you can watch the show again.
Thank you so much.
All right. Keep us posted. All right. We're going back to the phones. Let's see. Julie in Alachua. Julie, that's right near Dr. Poser's stomping grounds. Good morning.
Good morning. As a matter of fact, yes, it is. I'm really very familiar with Dr. Poser. He's amazing.
That he is.
So,
and his head's growing a little bigger. He might not be able to get out the door.
Oh, he really is one of the best guys I ever met. But I'm really happy to speak to you, Dr. Lang, as well. And I wanted to ask a question about my family. We have a family history of glaucoma, and I went to my eye appointment, and the doctor had stated that I have what's called glaucoma suspect, basically a premature irregular angle in the back of the eye.
Okay. So
is that something that you have any defense for? I mean, I know inflammation is everything, correct, these days. Is there anything associated with inflammation, or does it have to be a procedure that?
Well, it depends. It probably means you have narrow angle. So there's an anatomical angle in your eye from the iris to the cornea. If that angle is very narrow, increases your risk of something called an acute angle glaucoma attack, where the pressure goes up in your eye very quickly, very painful, blurred vision. You actually vomit during this. It's not a fun thing. It's actually relatively rare, But if you truly do have a narrow angle, they can prophylactically treat this with a laser. It's called they just punch a hole through your iris with a laser, and it's called an iridotomy. It's very simple. It's pretty much painless, covered by your insurance. But we also have technology now with OCT technology where we can measure that angle and the thickness of the cornea a lot better than eyeballing it with a microscope. So you may want to see if your doctor has that technology, because some people may look like the angle is closed or very narrow when indeed it really isn't. And so we have that technology at the Lang Eye Institute. Obviously, a lot of doctors have that technology. There's a very good glaucoma specialist in Gainesville, Dr. Maher Fanous, and there's some other good glaucoma specialists there as well. But that doesn't mean you need to see a glaucoma specialist. Anybody with this technology can determine if that's the case. Other things that make you a risk for glaucoma are a large, what we call cup to disc ratio. That's an enlarged pit in the middle of your optic nerve, or slightly elevated intraocular pressure. So anytime somebody's suspicious for glaucoma, we want to do a series of tests. We want to run a visual field test. We want to do an OCT and look at the nerve fiber layer. We want to do gonioscopy to look at the angles. And we want to measure the thickness of your cornea as well with something called pachymetry. And if all those tests are normal, then you do not have glaucoma. And it's something just to keep an eye on, really. Some things you can do preventatively and proactively: cardiovascular exercise, okay? That can bring the intraocular pressure down, improve circulation. All right. Omega-3, believe it or not. I just wrote an article and published it not too long ago on omega-3 for glaucoma. Studies show that if your omega-3 levels are elevated, and if you're taking 1,500 milligrams at a minimum of a triglyceride form omega-3, it can reduce intraocular pressure, improve visual fields. So it's a very good nutrient for people that are suspicious for glaucoma and people that do indeed have glaucoma. We're actually working on a glaucoma supplement now. We've run into some issues with minimums, so we're working with the contract manufacturers because I don't want to have to make 10,000 bottles for a new product. But that might be something that comes to fruition that we'll have available soon in the next 3-4 months.
Interesting. What you say in the meantime? Consider the supplement you were talking about at the beginning of the show.
Well, yeah, I think everybody that's suspicious for glaucoma, I mean, heck, everybody should be either eating more cold water fish like salmon, sardines, anchovies, herring, mackerel. All of us should be eating more fish. And if we're not eating much fish, taking a good triglyceride form omega-3 or reestified triglyceride form. There's only a few good ones on the market. Of course, Fortify Vitamins is my brand, and we're less expensive and more potent than the competition. So it's something to think about. Remember, it's not a cure-all. It's not a treatment. It's nutritional support for your eye and for your entire body.
Absolutely. Well, I'm looking forward. And where can I get your supplement? Here locally, or do I have to go down to Ocala?
Well, you could go to the Lang Nutrition Center Ocala, but if it's in Gainesville, if you order it today, you'd get it on, it probably won't get it on Monday. You get it on Tuesday if you go to fortify.com. And when you order it, you automatically get another one. You get two. That's the BOGO. It doesn't say it on there, but you buy one, you get an extra one with that BOGO right now. It's called Fortify Super Omega.
Perfect. Well, thanks for everything you put out. You're wonderful.
All right. You take care. Phone lines are open. 1-877-969-8600. Give us a call. Dr. John Poser and myself, Dr. Michael Lang, and Roger P. Shulman and Dr. Susan Somerton. It's like the old days. The big show is back. All right. 1-877-969-8600. Dr. Poser, a lot of people will have these eyelids that turn in, and that's called entropion. And those eyelashes drag against their cornea, and they come in, their eyes are red, inflamed, and they're miserable. So it can be a spastic entropion. Sometimes we pull it down. Sometimes we put a little tape there for a few days, and it breaks that spasm. But ultimately, they need a little procedure that's not that complicated, correct?
Yeah, that's a procedure where the small cartilage that's in your lower lid becomes folded in instead of folding out. Just through aging and atrophy. So you have to do a procedure where you put maybe another little piece of cartilage in there to support that area so it doesn't flip in on itself. There's also a ligament that gets loose that goes through the lower eyelid that has to be tightened up too, because that can cause pooling and with dry eye caused pooling makes it even worse. So those are two procedures you can do to make the lower eyelid better.
And I'm gonna just I know we don't like to talk about prices, and you might be going, no, don't talk about it. But I know that you do one of the best upper eyelid jobs of anybody around because I've seen your work and you've done literally, I mean, I don't know how many hundreds of our patients over the years, but the problem is if people do not qualify for eyelid procedure due to their insurance, it can be very costly. And a lot of times, they're charging you for the surgical fee, the facility fee, the surgeon's charging a lot. And if you pay cash, it can be thousands of dollars.
Yeah, I decided not to take insurance anymore because it's just too much of a hassle, too much, red tape, et
Right.
cetera. So I just charge a certain fee. But fortunately for upper eyelids, people want to have insurance pay for it, but I'd say half don't qualify. Therefore, I just say I'll do it for $500, and a lot of
Wow.
people come in for that. And then if they want something else, of course, it's full price. But that's kind of my donation to people and their upper eyelids as a plastic surgeon at this stage of my career.
Well, I don't know anybody in the country doing upper eyelids for $500. So that's a good deal. And we thank you and our patients thank you.
Well, you're welcome. I enjoy doing it, and I make a lot of friends, and most of them come back for other procedures. So in the long run, it works out. It's a win-win for everybody.
Right. We got to still keep you. You got to still make sure you have gas for your car.
Yeah, I need to get to the show so I can
That's right.
talk to.
All right. We're getting ready to go to the next call. Remember, I want to invite everybody to come out today and tomorrow. This is August 19th and August 20th for the Florida Fit Festival. It's at the Florida State Fair. Fortify Vitamins is booth 1001. Remember, we're doing 25% off all Fortify supplements. We got a big crew out there now. I'll be there, and a lot more of the team will be showing up probably about 11 o'clock today. So it's today, the Florida Fit Fest at the Florida State Fairgrounds, booth 1001. Remember, BOGO on Fortify Super Omega, and also all of you out there taking our Macula Defense vitamins, the zinc-free Macula Defense and the regular Fortify Macula Defense is also a BOGO until we're out. Remember, we released the new next-gen Macula Defense, so we got to sell through our inventory of a Fortify Macula Defense, which is a great supplement, and you're basically getting 50% off, and literally thousands of you are taking it. So take advantage of that. All right, we're going back to the phones. We're getting loaded up. We got a lot of people on hold. Let's go to Steve. Steve, thanks for holding. Good morning, my friend.
Yeah, you were talking about the cost of procedures and things, but think about it for a minute. Most people are willing to dump $60,000 into their new Ford truck. They're willing to spend $200,000 on a house. They're willing to spend these huge amount of money. Come on, what's more important, your body or these quote material things? And I just never could understand. Yes, medical things are expensive, but they're always cost effective. They say there's three things that are cost effective for sure. Like if you were selling stocks, it's a gamble. You'll always make money on preventative medicine, education, and a good pair of shoes. So I think that the way we worry about cost in medicine, although it is an issue, is in terms of what a value is to the individual is totally overrated.
Right. I tend to agree with that. And we've got a procedure we do at the Lang Eye Institute, and Dr. Somerton and I were just talking about it, a procedure called the Optomap California. It's a $39 fee. And a lot of people are saying, well, why doesn't insurance cover it? But this little Optomap can literally be life-saving. We can pick up melanoma that we can't see, retinal holes and tears we can't see usually, hypertensive and diabetic changes, all sorts of things. And it's a $39 fee, but it's a form of prevention. Everything isn't covered by insurance. But that's a really great procedure, isn't it, Dr. Somerton? We're seeing some stuff. We're finding some stuff that, I don't want to say we missed before, but it's just this technology is so amazing. It finds things that the typical doctor can't see in the eye. Isn't that correct?
It is amazing. And every day, the more patients we use it on, the more we just wish we'd had it all along. Back when we graduated, not that it was that long ago, but we had to draw the picture of the eye when we saw it in little sections. And now we get the whole scan of the whole eye in one picture in full detail, vivid. and we get to educate the patient about what we're seeing. We can follow the patient. If there's anything there, we can look for change, because things in the eye, most often if they're stable, that's good. But if they change, that's bad. And we pick up things early. And so we can really go after that preventative medicine and give the appropriate lifestyle advice or nutrition advice, or even, if they need surgery advice, we can get and see and take care of it as soon as possible.
Right. And this OptoMap also does, we paid a little extra to get the famous autofluorescence. And autofluorescence actually picks up a metabolic waste product in the eye called lipofuscin. And if we detect this early, that can aid us in the early detection of things like macular degeneration. And believe it or not, even neurodegenerative diseases like dementia. And if we do see this autofluorescence, this lipofuscin in the eye, we can adjust your diet. And believe it or not, certain supplements can decrease this. So once again, the key is early detection. Steve, thanks for the call, my friend.
Yeah, one more question. Bob said that he was concerned about the prednisone for his wife causing diabetes.
Right.
Okay, that's a glucocorticosteroid. And the reason it's called gluco is because it increases glucose across the cell membranes. That's why you get, it increases blood sugar going across. Could it cause diabetes because it's substituting for insulin? And then when you go off of it, you don't have that, and the insulin can't come back to the normal level? Is that maybe why it causes diabetes?
Well, we're not endocrinologists, so that's a good question. But I would assume that it has something to do with the metabolism of glucose, but also probably retards the strength of the insulin somehow, as all stress hormones do. So it probably is a combination of both of those two things. But I'm not an endocrinologist.
Okay. Well, I think you probably know more about endocrinology than most endocrinologists do, doctor.
Thank you.
Thanks, Steve.
Okay.
Have a good
God
one.
bless.
All right. You're listening to Ask the Doctors. 1-877-969-8600. You can also go to my website, drmichaellang.com, and that'll take you to all of our websites. So drmichaellang.com. That'll take you to our YouTube channel, the podcast channel, Instagram, and everything, drmichaellang.com. But remember, the supplements that we talk about and that we develop and do research on is that website is fortify.com. Fortify, Fortifie, fortify.com. I had one of those brain lapses, right? A brain fog moment. All right, let's go back to the phones. Let's see, June in Gainesville. June, good morning. Welcome to the program.
Hi.
Hello.
Hello.
Howdy. What can we do
Hi.
for you?
This is Dr. Poser's granddaughter, June. I was just calling to say hi to him.
Well, hi, June. I was going to bring you up what a volleyball star you are, because Mackenzie, Dr. Mike's daughter, is a very good volleyball player too. So I want to hook you two up so she could teach you some moves on the volleyball court. Okay.
Okay.
All right. Well, thanks for calling, and keep working hard at volleyball.
Okay. I have a lesson on Sunday.
Okay. I'll come watch.
Awesome, June.
Okay.
Thanks for calling.
Thank you.
Bye-bye. Ah, that was sweet. And Mackenzie is actually, this is her last year of volleyball in high school. She's a senior, and she's playing for Calvary. She's been playing volleyball since the 3rd grade, but she's getting her academics in line now. She wants to go to Vanderbilt, and she wants to go to medical school, and wants to go into sports medicine right now. But maybe I can skew her to go into ophthalmology and be one of our surgeons. But she also may want to be a rheumatologist like, her grandfather, my dad was. So, but who knows? Once you're in med school, things could change. And who knows? Once in college, things can change. She watched Suits a lot. So she might want to be an attorney instead of a physician.
Well, I won't, no comment there. But I will say your dad was from Mitchell, South Dakota, and I went to medical school in South Dakota. So we were only about 30 miles away from each other. I probably got some of the corn from your cornfields there, Mike.
That's right. Mitchell, South Dakota. We had a lot of land there, 5 square miles. And my dad was like a dirt poor farmer growing up, I don't know, at 5 square miles, seems like that's a lot of land. And I think it's probably worth a lot of money today. But, back in the 1700s, it wasn't worth that much. Well, actually, the early 1900s, the mid 1900s, I guess it was.
Nobody moves up to Dakota though, so
That's true. It's not a booming area like Florida, is it?
no.
You know, the Villages is the fastest growing city in the entire country right now.
I heard that it's also the best place to retire in the country. We had a story on that the other day on the news.
Well, if you like golf, pickleball, tennis, it's absolutely the best. I mean, it's like 65, 75 golf courses. All right, we're going back to the phones. You're listening to Ask the Doctors this morning. Dr. Michael Lang, Dr. Susan Somerton of the Lang Eye Institute, and Dr. John Poser, plastic surgeon. All right, let's go to the phones. Barbara in Palm Harbor. Barbara, good morning.
Good morning, doctors. And that was such a precious call from that darling little girl. And it's wonderful to hear P. Sherman's fabulous voice. That voice is magical. But anyway, now on a serious note, there's a lot of, we know, diabetes and these medications like Trulicity, all these different medications for diabetes. They've all got such drastic side effects. My husband is on Trulicity. It does a fantastic job with the blood sugars, but the side effects that this drug has on the digestive system and on general health. Is there any suggestions at all that you guys can give me to combat these side effects?
Jeez. I mean, the key here is obviously to be on the least amount of medication that gets the job done. And you're well at that, Barbara. I mean, you're a nurse and know a lot about nutrition. And so the combination of the proper diet, weight management is crucial. We can all look down and pinch a lot more than an inch these days. And so weight management is one of the best things in the world, getting on a specific exercise routine, as long as your heart and your physician allows it, getting down to your ideal body weight, proper diet like the Lang survival diet. Believe it or not, omega-3. And if you go to a website called healthbenefitsofomega3.com, healthbenefitsofomega3.com, there's a article there on omega-3 and diabetes, also one on omega-3 and glaucoma. The newest omega-3 article they just found out is actually good for your lungs. So I do recommend omega-3 for everybody. And obviously, if your blood sugar still isn't in control, you're going to need to be on medications, right? And the problem is medications aren't without inherent risks. And so all I can say is minimizing your medication through lifestyle adjustments, dietary changes, but you can't stop taking those because a lot of people listening, remember, this is not a treatment. You got to follow your advice of your physician always, but find a physician that's in tune with the holistic approach and that wants to give you that opportunity to try to do it as naturally as possible. Dr. Poser, you want to add anything about that?
I was just going to add something about, the anti-inflammatory part of your practice with vitamins. All diseases are caused from inflammation. And over a 20-year period, if you have chronic inflammation in a certain area, it can turn to cancer. So you should try to do everything you can to reduce inflammation in your body, which is what Dr. Lang recommends, including weight loss, anti-inflammatory vitamins, which are really coenzymes, things like that. But that's the key to life. Keep your inflammation down, and you'll live a much better life, a much longer life, and you'll decrease cancer and decrease your pain.
Okay, thank you so much.
All right, Barb, come on out to the Fit Fest today and visit with us at the booth.
Yeah, my kids are there, so that's a good idea.
Yeah. All right. Take care.
Take care. Bye-bye.
And, where can you go really around this country and see a group of doctors that are in tune with nutrition? We have Dr. Susan Somerton, who has every nutritional degree after her name, myself, who's also a certified nutritional specialist, Dr. Richard Hall, who's also a sports nutrition guru. And then we refer to doctors in our network like Dr. Poser, who's also in tune with nutrition and has an open mind about, a holistic, natural, integrative, complementary medicine. But we practice this daily in our practice at the Lang Eye Institute, don't we, Susan?
We do. We want to not only talk about their eye, but we want to talk about their holistic approach, their whole body. And these medicines, even she's talking about with these diabetes medicines, they work when used along with diet and exercise, they're not to substitute diet and exercise. And the same when it comes to the eyes connected to the rest of the body. So we got to help the whole entire body to get people even just seeing better.
Absolutely. And we're about out of time. So you got to tell everybody goodbye. And then I'm going to get Dr. Poser to give the phone number.
Thanks for listening, everybody. Go have a nice preventative health day. Get out in the sunshine, eat some fruits and vegetables, and move a little.
And Dr. Poser, do you have a phone number for Poser Plastics?
Sure, I do. And I just want to thank you, Mike, for allowing me to be on here, and also to all your great listeners out there. My phone number is 352-372-3672.
Good.
You can call it, ask for me, and I have offices in Gainesville and Ocala and in Tampa. So nice talking to everybody.
Great. And we're going to have you on as another guest soon. We didn't have time to cover half the stuff we want to talk about. All right. Thanks for tuning in and listening to Ask the Doctors this morning. Go out and have a great Saturday. God bless you. God bless America. Come out to the Fit Fest at the fairgrounds. See ya.